So as George said, my name is Stephanie Coen and I'm an assistant professor here in the school. And the central question that I want to pose to you today in this mini lecture is, why is health a geographical issue? And throughout what follows, we'll explore some key questions and topics that come under the human geography subdiscipline that we call health geography. So I want you just to think about yourself for a minute. How do you feel when you move through different environments? What about green spaces or blue spaces? Do you think these kinds of places affect how you feel mentally or physically? What if you lived near a green space or a blue space? And what if you could rarely access these types of places? How do the neighborhoods we live in shape the opportunities that we have to live our healthiest lives? Do they provide places to meet our everyday needs, to be active, to access good quality food, to access public transport? What about exposure to pollutants and traffic? What about the quality of our housing, access to secure shelter? How about our feelings of safety where we live? And what about where we play? Are there safe and welcoming spaces? Do neighbors talk to each other, or are they disconnected? Is there a sense of community? There are so many different questions we can ask about how our environments affect our health. And this matters because health outcomes can actually be very different across places, and we need to understand why. So if I asked you what the life expectancy is in the UK, what would you say? Have you ever thought about how life expectancy might differ across the country? I want you to take a look carefully at these maps. So one is for men and the other is for women. What do you notice? Do you see a north-south gradient? What about any differences between women and men? Do you even notice how some of the areas with the lowest life expectancy are actually adjacent to areas with the highest life expectancy? And what might explain these spatial patterns? What might explain these inequalities? Health geographers would look at both the material and social pathways that connect these different health outcomes, these differences that we see in life expectancy to place, to environment. So everything from local policies to levels of social cohesion in communities to the layouts of infrastructure in our neighborhoods. And what I want to suggest to you today is that health is actually a way into thinking about the relationships between people and places, which is really the core of what we do in human geography. And one of the defining aspects of our subdiscipline of health and medical geography, as illustrated by this comic here, is that we actually look to a range of factors outside of the body when we're thinking about health. So everything from very localized micro issues of access to facilities to wider societal and systemic issues like social class and other injustices. So a health geography approach allows us to think about the various aspects of the environment, contextualizing our lives, and how this filters down to actually affect our bodies and our health. So from a health geographical perspective, health is about changing our environments, not just about treating ill individuals. For example, giving the person here in this comic some cough syrup will do little if they're still exposed to this wider metaphorical smoke of injustice. So what I hope you take away from today is that health and environment are inextricably linked. There are spatial and scalar dimensions to all questions of health and illness. And there is a diversity of topics that can be studied within a health and medical geography framework. So now I want to give you just a short example related to some of my own research on how our environments shape gender differences in physical activity. So my concern with health is always grounded in a concern with equity. So I want to know more about what are the environmental factors that negatively affect the health and health opportunities of some groups of people. If we can identify them, we can work to change them. So when it comes to physical activity, we know that physical activity generally is good for our health. We're kind of bombarded with messages telling us to move more. But actually, globally, physical activity is characterized by gendered inequities, whereby men are more likely than women to meet the minimum recommended amount of physical activity that we actually need to support our health. So what's interesting to note here is that there is a global geography to this gender gap. There are places where the gap is wider and narrower. And now this map shows the gender gap in physical inactivity, so measuring how inactive women are as compared to men. And the UK is somewhere in the middle, whereas in Brazil, men's and women's rates are much more similar. And in Ecuador, we can see the gender gap is really quite wide. So what is going on in different contexts that shape the nature of the gender gap? And how do these types of gendered inequities become normalized or taken for granted in everyday places in our everyday lives? And that's the question that my research seeks to address. So what I'd like to do now is just zoom in to the very micro scale of the everyday places where we practice and engage in physical activity. So this is my area of research. So the work I'm going to share with you was a qualitative study that was looking at the role of place in this gendering of physical activity, in this creation of gender differences in physical activity. It was some work I did with Canadian women and men aged 25 to 64 years. They all self-identified as regular gym users, and I used a range of qualitative methods that included interviews and actually drawing. So participants engaged in a drawing activity as part of the interview. And then a subgroup of my participants kept journals for a week, documenting their experiences. So I'll share just a few of the key themes that I identified in this work. So one theme was around embodying gender. So this was about how participants made direct connections between their desires to attain particular gendered ideals and their chosen gym activities. So this shows how doing physical activity and expressing gender are actually inseparable in the environment of the gym. So one of my participants wrote in her journal, she said, "I began with the side glide machine. Still don't know what it's called. I did this for 5 minutes and I asked myself, why do I pick this machine? Because I really don't like it. Then it dawned on me. Someone told me it was good for my inner thighs." So this quote really helps to illustrate the kind of scalar dimension. And again, scale is a very geographical concept that you'll come to learn loads about. But this illustrates the scalar dimension of how gender in the gym operates, connecting our very individual level practices in very specific places with wider socially constructed images of, in this case, a desirable feminine body. The next theme is what I've called policing gender. So this was how men and women directly linked their avoidance or limited participation in certain activities and spaces to their gender identities as women and men. So both women and men talked about limiting some of their gym practices as a way to conform to more normative expressions of masculinity and femininity. And they were worried about being kind of socially sanctioned by others if they contravened these norms. So one of my participants says, "Gender definitely defines the stereotypes of what people do at the gym." You could even go so far as to say what people are allowed to do at the gym, depending on what the norm is. I try not to constrain myself to those things, but there are, typical female exercises or activities that I don't want to do. But it's not because I don't want to do them. I wouldn't mind doing them, but it's just because I feel like I can't. So there was this kind of regulation that reinforced men's and women's participation, expressed as kind of a duality, occupying distinct spaces and equipment in the gym in this form of very oppositional gender relations. So again, this illustrates how the social structures that kind of polarize gender identities, that polarize women and men, can be barriers to engaging in the full scope of physical activity participation in the gym. And this is captured very concretely by one of my participants who, in her drawing, drew quite literally this kind of polarity in terms of masculine and feminine experiences in the gym. The final theme I'll share with you was around spatializing gender. So this reflected how men and women engaged in kind of spatial practices that reinforced a particular gender hierarchy that favored a certain type of masculinity. So men described avoiding or leaving spaces when this masculinity was at play, and women often felt crowded out of spaces. And they ended up kind of minimizing some of their use of time and space in the gym. And the sort of collective effect of this was that actually there was sort of a forfeiture of space to a particular type of masculinity, and this really had an exclusionary effect on the participation of some users. So one of my participants, a 57-year-old man, said, "I'll avoid ones where, where the big guys generally hang out. I find the weight area is very male-dominated." And another one of my women participants wrote in her journal, she said, "It is intimidating, particularly when you are the only woman there and you are lifting small weights compared to everyone else there. It makes me feel like I need to rush because I don't want to be holding up equipment others may want to use, and it makes my workout feel rushed." So collectively, what I've tried to illustrate to you with sharing these findings is how these place-based processes contribute to how gender differences in physical activity become normalized and taken for granted. So what I hope this shows you is how place, how our everyday environments can matter for health and health equity. So we saw that at the micro scale, the gym contributes to this normalization of gender difference. And these gendered processes form part of the context in which we make decisions about how we participate in physical activity. And I think a really important point is that these processes worked to polarize men and women, to really sort of entrench gender differences, but it's actually so much more complex than men versus women, that it actually has to do with these gender relations, and that addressing the gender gap that we see much more widely in physical activity requires that we contend with these very particular place-based sets of gender relations that prescribe these very rigid boundaries of masculinity and femininity, and that are working to maintain this social and material distance and difference between women and men. So my work really shows that we must consider the specificities and these dynamics of inclusion and exclusion in everyday physical activity places like the gym if we want to work towards greater gender equity in physical activity participation more widely. So that gives you a little snippet, a little taster of some of my work, maybe something that you hadn't really thought of as coming within the realm of geography, but it is a wide world out there for health geographers. There are so many possibilities and so many fields of application that you can apply this particular subspecialty to. So pretty much really any health-related issue can be looked at from a geographical perspective, and questions of space and scale always matter. There are many other disciplines, from health sciences and medical approaches, that are increasingly taking up spatial approaches to health. This has even been called a spatial turn in other disciplines. And disciplines like medicine and other health sciences are increasingly looking for people like health geographers to bring those social science perspectives to bear on questions of health. And as human geographers, we're really uniquely positioned to collaborate with other human and physical geographers on issues in particular related to things like environmental exposures and health. And there are examples, many examples of the ways that health geographers are making really important contributions at all levels of policy and community development in really exciting ways. So that's it for me. I really do hope that you'll come and join us next year and join me in thinking geographically about health.